would just start today on this topic. It's one of those topics that, you know, it's what the future holds. And you know, even though I do have a crystal ball, I have never shown you this, I don't think, Eric, but yeah, I really have one right here. So I'm going to look in this today and kind of see what doctors need from our licensees for 2017. We've been doing this for 23 years, as you pointed out, and there's lots of things that are happening right now that are, you know, pertaining to doctors. Adam just sent us this before we started the webinar, so I stuck this slide in there, Eric. This is on revenue cycle management market. It says it's worth 80.56 billion US dollars by the year 2021. And if you look closely at the quote here, it says it's up from 45 billion. So folks, this is a $45.5 billion industry in 2016. And in just, what, 5 short years, that's going to be doubling almost to $80.5 billion. So,
that's
Eric, I say if you're thinking about getting into a business, get into one that looks like those kind of numbers.
Oh, absolutely. I mean, I know as anybody that's on the call today and looking at trying to figure out which business to be in, I mean, I don't think we'll see this kind of growth with a restaurant business or a cleaning type business or any other type of businesses that we might see out there. This is
they're thrilled to have increases of, you know, 4 and 5%.
Right.
Just like our economy didn't grow really, but you know, very, very low growth over the last year. In general, businesses don't just take leaps and bounds like this, but look, it says it right here. It's a 12% increase in the next 5 years. 12% growth is just huge in the industry. So yeah, I tell people, Eric, all you need to do is picture a pie that has $80 billion in it, or even $45 billion, and all you need is a little tiny slice of that pie to make a pretty good income.
That's right. Patrick, Jeffrey's asking a question here, and as you're pulling up this next slide here, let's first mention that we will have a printout of today's slide deck at the end of the webinar. So hang in there, so you'll have that. You can watch it later, show it to a partner if you need to. But Patrick, as we kind of end this year, and this is a question we get out through the year. Ever since I've been here, I know we've had this question about, you know, how many licensees have kind of come through the program. How many are still active as licensees? And all I know is that the number is growing, and people are retaining their business in this particular field. Now, we know that people are going to make out of this business what they're going to want to make out of this business. There is no doubt that there's huge growth potential here. And for those that want to stay in this business, I think we say stay in this business for a very long time.
Yeah, and in general, of course, being a privately owned company, we don't share a lot of details there just because we might have, you know, our competitors. I mean, the guy that asked the question, we're sure he's not one of our competitors, but he could be, right? We don't know that. So we don't give out real detailed information just like any privately held company wouldn't about sales and so forth. But I can say this. Last year was one of our best years. It seems to be growing in popularity and the number of people who are coming through our training. So, you know, we brought through, well, we do about 8 trainings a year now. I forget because it's about once every 6 or 7 weeks. Right. So, folks, we did bring through almost 100 people probably last year. Now, remember, there are people in the past, we haven't brought that many in years past, over the years, 23 years, but we have put people in business since 1994. Now, that doesn't mean that they're all out there actively trying to get new clients because, Eric, as you know, we hear from them all the time that say, hey, my biggest problem now is how do I turn away business because I'm getting so many referrals from doctors and it's growing. And so a lot of people get to a handful, literally a handful of clients, and they stop marketing because that's all they need. So I think people ask that question, Eric, for, you know, they want to know how successful our people are and how much competition there is out there. Well, this market is so huge, there's almost 1 million doctors in the United States that you could hardly saturate. It's like here in this area, I just did business with a State Farm insurance guy, and I asked him, well, how many State Farm insurance agencies are there here in just the Dallas-Fort Worth area? And he said like 123. And I go, how could that be? Is there that big a market for it? He says, well, yeah, a lot of people need, a lot of people need insurance. So I don't think you can oversaturate something like this. And once our licensees get literally 4 or 5, 6 clients, they're done as far as growth. I wish I could say all of them want to build this thing like some of them have to over 100 doctors or more, but most of them don't.
Well, that's what Rhonda's asking. She kind of came back and said, what is your licensee failure rate? Rhonda, I think what you find out is that I think what you're really asking is how many people actually get clients. Because folks, when our licensees get clients, they're not failing. They're growing their business. So I think that's really more of your question of what you're asking is how many of the licensees come through and probably never get a client. We don't obviously know that question because we're going to show you a couple of people that Patrick has actually interviewed this year that we haven't heard from in sometimes, 6 or 7 years. And
Yes.
just kind of find out that their business is booming. So remember, Rhonda and everybody else that's on the call, we're not a franchise where we kind of keep up with who's got clients and who doesn't have clients. There's a lot of people that we haven't heard from who still are getting clients. So we would say this. We're starting to see probably more people get doctors quicker than ever before. I would really be able to put my money down on that one.
Well, the live demos, Eric, is one of the reasons. Here in just the last couple of years, we've been doing demos of our system, our cloud-based system, for you. As a licensee, we'll do a demo for you and your prospective doctor. So we get on there, we show them all the advantages of doing business with you, we answer all their questions, and Eric, we're closing, what do they say now, close to 75% of all of those turn into clients for our
Yeah, absolutely. Yeah. Yeah, because there's such a high return because, again, Rhonda, I'm going to get back to your question. People who fail don't do it to what we teach. So what we see is people that are failing and getting a client, they actually come back to us and say, what am I doing wrong? We start asking them what they're doing. We find out that they're not doing what they were taught in class, get them right back on the right track, and they end up getting a client. So I would say that's just what you got to do.
And Eric, we're going to point out towards the end of the webinar here some interviews that we did in this past year, and every one of those will tell you that if they just did at the very beginning what we taught them to do in the workshop. See, some of them go back and think they know better than we do, and so they're going to try things that don't work at first, and then they come back to us and we ask them a lot of questions, and we'll kind of hand-hold you through that process because we know it's important, folks, for you to get that first client. Obviously, our investment is $25,000 licensing fee for our system and all of our support and so forth, and that's a lot of money. So you need to get at least one client, and then once you've done that, if you do a good job, Eric, it's just a matter of just waiting for the referrals at that point, huh?
Absolutely. And let's get to the next slide, and I'm going to answer Rhonda's last question here. She says, well, those licensees who have too many referrals, will they send them to another licensee? Rhonda, you got to understand, this is a relationship business, and if one doctor's given a referral to another doctor, it's to that particular licensee because they've built a relationship. That's what we're going to help you learn how to do. We're going to teach you how to build those types of relationships so that you get the referrals and not another licensee. So, Patrick, as we're going into 2017, I found this article, it says there, Christmas Day on December the 25th. Top 10 challenges facing physicians in 2017. I thought, what a great way to end this year going into 2017 on these webinars.
Yeah, so let's talk about what at least this one publication says is one of the challenges is MACRA.
Yes.
So tell us a little bit about MACRA. Some people may not even understand what that's all about.
Well, I'm going to make it simple. Anything that you see here on what we're going to talk about right now has to do with Medicare and what they're wanting doctors to record or capture as data. And they're going to get reimbursed. We've already gone through this once before with what's called meaningful use. We've already done meaningful use 1 and 2 and 3. Some of you may have heard about that along the way. But MACRA is the new part of where they're documenting and reporting every treatment that's going to go through a certified EHR or some other approved method. This is the only way that doctors are going to get paid for their services. So now they're going to have to capture that. So those folks, everybody that's on the call now, and those that are going to be listening later, what you need to be finding out is this. If you're going to get into medical billing, you have to know that your software is MACRA compliant. Our software has been this way since the beginning of 2016. We already have doctors that are reporting the proper things on here already. So folks, if you're looking to get involved in any type of medical billing business, you had better have a software that is capturing, as you can see here on all of these different screens that we've already done some screen captures here. This is what you need to have, and this is what doctors are going to need to have just to keep them at a level where they're still getting paid, Patrick. It's amazing the governmental restrictions for doctors now just in order for them to get paid.
Well, and the good news about all this, folks, even if this doesn't make any sense to you at this point, just what we're trying to convey is that you don't have to worry about figuring all this out on your own. You know, there are people who say, well, you look, for $25,000, I can go out and start my own business. Well, that's probably true. You would spend $25,000 probably just on the marketing materials that we've developed, not to mention the training that we do and the ongoing support and the ongoing training webinars that we do every week for our licensees. But the point is, you could do it on your own, but then how do you keep up with all of the changes that are coming down the pike all the time? Your software has to be kept up to date. That's very important. But you have to stay on top of it, too, to be able to convey to the doctor why you are the solution for that. So just take that down, macro, and do some research on that, and then ask any other companies that you're looking at for software, at least, to make sure that they are macro compliant. That's a very important thing. All right, let's look at challenge number 2, Eric.
Patrick, one thing I want to say about that macro real quickly, there's only going to be two categories of doctors, the winners and the losers. And if they're not set up, you're going to find a lot of doctors losing, and they're going to lose their business if they don't have that right. So that is so important, folks. Now let's get to the second one, prior authorizations, Patrick. This is eating up the doctor's lunch.
Yeah, and you know, people probably know that there isn't such a thing as eligibility. In other words, the doctor's office needs to check and make sure that that patient is covered under that insurance policy even. Well, the prior authorizations have to do with specific things that the doctor is going to do for that patient. And as you can see, here's one doctor, Dr. Ellis, who is an internist. He says he puts in about 32 hours a week, him and his staff, handling prior authorization. So this is a very important part of the doctor getting paid.
Yeah, and what we're going to try to relay to you is this, is that our system can keep up with that. You can see our iClaim down underneath Realtime. That's where they can get real-time pre-authorizations from. So, folks, there's not really another system out there. Now, obviously, we're only limited what the insurance companies will give us anyway. But we can capture this information in our system where it's going to track it. Imagine that you know, God forbid that you end up in a car wreck and you have to have pre-authorizations to go see a physical therapist. And then there's so many visits that you can have. This system keeps up with that, and that's what this other doctor's saying, is that they have no way of keeping up with this. So every time their patient has to come in, they have to go back and find out how many visits are left. Because remember, if there's not a pre-authorization, the doctor's not going to get paid. They're doing services for free. Our system captures all that information, again, to help increase the doctor's cash flow. So this is just another area of where we just feel like there is no other system out there on the market that can capture this kind of information and keep up the way that it does.
Yeah, and what's amazing to me, Eric, is that our programmers know all of this ahead of time. We're constantly in touch with Medicare and other government agencies telling us what's coming down the pipe so that we can change our software to adapt to that. And it's just amazing where we're always steps ahead. When the new codes came out last year, we had already put those codes into effect a year ahead of time. So it's a matter of just not letting technology, you know, and the changes and the rules get ahead of you there. Okay, number 3. Now, Eric, I think we reminded people that they should be asking questions over in the question box. So why don't you just jump in anytime if you have a question that I'm not paying attention to the question box.
Yeah, I'm watching those too. I kind of got those down here. Yeah.
Good. All right, so Eric, challenge number 3 for doctors next year: negotiating with the payers. What does that mean?
Oh my goodness! Imagine, folks, that doctors. I mean, when they think they've got. Here's where I'm going to answer the question: why would a doctor want to outsource their medical billing? Here's a good reason why. The person that they've hired there to process claims, remember, that's all they can actually end up doing. With us as a large group, of ABS licensees throughout the country. We have people that specialize in these things. So we can help you negotiate for your doctor areas where the physician just can't do it. So think of this as you are their consultant. You're their performance improvement consultant, because payers, and we're talking about the insurance companies, Medicare, Medicaid, Blue Cross Blue Shield, all of them, they're saying you either take what we're going to give you or don't take anything at all. We have specialized folks here within our network that can help you do that. And then through all the solutions that we have here, as you can see here on our Physicians Toolbox, contract negotiations, folks, you have that, which from day one, Patrick, coming out of training class, right, you can have as one of your specialties of helping doctors. And this is number 3 on the top 10 issues that doctors are facing going into 2017.
Yeah, so folks, all of those services that you see illustrated there from some of the other flyers that we have, those are all ancillary services that we came up with so that you have a total solution, not just the billing for the doctor, but every aspect of the cash flow, the revenue cycle management for that practice. And one of them that we don't even have illustrated here, because we don't talk about this one much, do we, Eric? In fact, that's probably the first time we've ever shown this actual flyer, because it entails, as you can see, 7 different things there. So the Physician Toolbox is a very important part, though, of what we offer to our licensees. Again, you're buying the total solution, the turnkey solution for those doctors.
Matter of fact, as I'm looking at this, Patrick, we actually probably need to get this updated. That second one bullet right there, meaningful use systems, we actually need to change that to macro systems up there, because
that's a good point,
folks. And so that is, I'm glad we put that up there. Wow.
Number 4.
Yeah. Staying motivated to practice medicine. Patrick, I'm going to let you kind of take this one, because you've been working with a doctor, Dr. Vicki Rackner, in writing a book on the increasing workloads of doctors, their frustrations, being able to spend sufficient time with patients. I'm going to let you kind of take this one, because you've nailed it in the book there, in the New Thriving Medical Practice.
This is the book he's talking about right here, folks. You can actually get this on Amazon. It's $24.95. We price this for doctors. Doctors are used to paying a lot of money for valuable information. This is a book that was co-written with Dr. Vicki Rackner. She's a retired general surgeon in business, in practice for about 30 years, and she's helped thousands of people over the years. But she's also now helping doctors to thrive in their medical practice, because some of them are really struggling. Well, we've come up with the answer. And Eric, as you can see, we're illustrating there that during our workshop, we go through this book and actually highlight pages and sections in the book itself that the doctor can look at. And then we stick those little sticky notes that you see on there so that the doctor knows exactly. So when we have you, as a licensee, can buy these books for $4. That's our printing cost, folks. Yeah, $4 a piece. You hand that out with your business card, your contact information inside of it, and all of these tabs marked already. The doctors will read this. Eric, we have a lady who came through training in September, as you remember, Jennifer Boyd, who went out and used this book, gave out 3 of them. 3 doctors called her up, said, you're right, I need help. Come help me. And she went back and did the free practice analysis that we teach people to do, asking a bunch of questions, put it into the system, and wow, it helped.
Yeah, I think actually on this next slide here, some of the highlighted areas of those books there that are already on there. And so, folks, we already know what to highlight, show you. It's strategically put in there so the doctors don't have to read the entire book. They just go to certain areas. And then Dr. Rackner just put out another book.
Right.
The Rich Doctor. Folks, these 2 books, and this is why I told some of the people that I'm dealing with and that are actually on the call today, you are going to have a marketing sledgehammer, I'll call it that way, with these books, because you're going to be able to give these out for those that are in fear of marketing. If you can just simply get these books in the doctor's hands, they're going to read it. So just think about going to a doctor's office. You're not dropping a business card. You're dropping off one of these books.
Right.
You're going to get contacted.
Yeah, and look at this quote from I think this is page 83. We have it marked. People use it and they mark it. And look what it says. Dr. Rackner. This is another doctor now speaking to other doctors who are reading this book. Physicians in private practice, something about away from an average of 30% of their income. Oh, they give away when they do not follow up on rejected insurance claims. Outsourcing your medical billing could bring claim rejection rates to as low as 2 to 5%. Look at that. Now look at this. She says to another doctor, this may be the fastest and easiest way to increase your cash flow. Isn't that a great quote, Eric?
It is. I mean, so folks, imagine that you've got basically a doctor in your hip pocket as you're going to market your business in revenue cycle management as a certified medical revenue manager. So we're giving you all the tools. So Patrick asked the question, can you go start this on your own? Absolutely, you can. But we've got these tools to help you and to help you increase. And this is, again, from medical economics, the fourth top most challenging thing that doctors are facing is staying motivated in private practice. And that's what we want to do, is keep these doctors motivated. We know money motivates them, so we want to help them with that.
And that's what these books do, is educate the doctor. So see, folks, we teach you to be an educator. That's all. You're not selling anything unless you could sell popsicles in the Sahara Desert. That might be fairly easy to do, right? Well, that's what we're doing here for doctors. We're talking to them about money. One of the taboo subjects, Dr. Ratner says, that doctors don't like to think about and talk about much is money. So she wrote this book specifically to help the doctor open up his brain or her brain and really focus on the fact that they need to be making money or they can't even stay in practice.
Right.
And they're struggling nowadays for that, yeah. All right, Eric, we better move on here. It's halfway through the webinar, and we're now on number 5.
Yeah, last one. Folks, there are 10, count them, 10 different challenges. We're only going through 5 because we know that we only have a certain amount of time today. But is maintaining their certifications. And again, this is another one of those areas where you can help the doctor be better at what they do. I like the phrase performance improvement. This is what we do. Folks, you can help them with their credentialing, making sure they're staying certified. You can help them do on-site consulting. And remember, being part of the nation's largest group of independent medical billers, at your fingertips through our support team, you have people who have already done all of this. So imagine that you're bringing this type of power inside of your business directly to the doctors, like I said, from day one, right after training.
Yeah, so folks, this is not a franchise. You do own your own business. We'll teach you how to set up your own business, name your own business, and so forth. So you're doing it under your name. But think of the power of associating with a doctor who's helping you to educate other doctors. It brings great credibility that you wouldn't have otherwise. And, of course, all the tools that we're talking about here today, of course. So here's the article. Again, there's the link at the bottom. When you get the recording of this or the handout here at the end, you can copy down that and go actually search that out. All right, Eric, I thought this was ingenious of you to kind of show what we've done this past year for our licensees.
Well, not only just for our licensees, but for folks that are looking to get into the business. I mean, folks, if you would go back and just review our webinars that Patrick and I do and other people do throughout a year, you will find out we actually give you a lot of information. Patrick, I just kind of highlighted a few of these here. So, folks, if you're looking to know what each one of the services do here at ABS, go to our YouTube channel and look up a closer look at our medical business package and training. That will help you get that information in a webinar. We go through these each one systematically, folks, and this is just Patrick. I mean, you and I attend a lot of our webinars with other companies and everything. I just don't see anybody giving this much money, this much information out as we do, because again, we want to educate our folks before they even become a licensee of American Business Systems.
Yeah, so we tell people, look, you may be on this webinar today for the very first time and not realize how much we've done this past year, but we're going to cover some of the topics that we've covered just to give you a feel for, folks, if you're looking to get into this business, you need to be on our webinars. Whether you can afford our licensing fee or not, or want to go out and do it on your own, you're going to get valuable information that will help you build this particular business doing medical billing for doctors. Here's another one, avoiding failure, how to build a bulletproof healthcare business. Eric, I mean, we can just go on and on here. Let me just throw some more up here. Here's one, getting clients, the top 5 ways to market to doctors. Now, folks, we can't do everything on this webinar today, but we're pointing you to our YouTube channel. And by the way, Eric, I don't know if we've actually given people the easy way to get there, but isn't it just youtube.com/YABS? Yeah.
I think so. I mean, we can certainly find that on there, or they can just go to our website. Just go to absystems.com, and up in the right-hand corner, you'll see our little logo there. It goes right to our YouTube channel. So if you can't find it on YouTube, just go right there. It'll take you right there. But we just want to show you
on the website. Yeah, there's a little bitty logo for YouTube, and that'll take you right to it. So you'll see this one on there. I think I clicked on something I shouldn't have. Here's another one.
Yeah, this is a great one right here. Folks, if you don't have a clue what medical billing does, this is the webinar you want to watch, because we go through it from a history standpoint, where it was, where it is today, and actually where it's going. So this is a great webinar to be a.
Now, each one of these webinars, by the way, just like this one today is being recorded, we do post on our website there under our blog and on the YouTube channel. But folks, they're all easy to watch. You can skip ahead. You can rewind if you miss something. You can just listen to it as you're doing other work. Just kind of let it run in the background there. You don't have to listen to the whole thing even. You'll get the gist of it and maybe get enough information out of each one of these to help you in starting your medical billing business. All right, here's another one. Start a business in healthcare with 0 experience. Now, this is a question you get a lot, right, Eric?
Oh yeah. Do I have to have experience? I've never been in medicine before. I don't know anything about medical billing. Do I need to go to school?
I need to know about codes.
Yeah.
The codes is what hangs people up on this, isn't it?
Yeah, absolutely. This one right here, Patrick and I went detail by detail of why, do I go to a school? Do I not go to a school? And then what do I get from ABS? And you can see here we've got everything of what you need right here, because you don't need to have billing experience. You don't need to have coding experience. We have all of that wrapped up in all of the services that we have. So absolutely, just go check that out. I mean, literally, we're just giving you information here, folks, to get there. Now, Patrick's showing you our website there, and I believe it's going to take you to our YouTube channel. There it is.
Let's hope it works. I'm clicking on it right now, live. So, there it is. Yeah. And look at this, folks. I mean, if you keep clicking on this show more right here, you'll see that we have just a wealth. Now, this is just for people who are looking at getting into our business. Our licensees have other webinars that we do for them almost on a weekly basis that have tons and tons of other information. I bet we have more information out there on the web than anybody else in the entire United States about the medical billing business. I mean, look at it. It just goes on and on and on. Keep loading more, and you see more. Eric, this goes back to, I think we started posting these in 2012 or something like that.
Yeah,
so.
I mean, it was, so we've got, folks, we have tons of information out there for you to get to. It's right at your fingertips. Then, this is probably just as good as any other webinars that we do, the interviews with actual licensees.
Yeah, Eric, I can't tell you how, if I were looking into this business, I wouldn't believe a word that you say to me or that I say. I would want to hear from the people who've actually spent the money, they paid the licensing fee, they came down and sat through our week-long training workshop here in Dallas, held at a Marriott hotel. We'll show you the details here in a minute. And they're out there building their business. So I interview them and let them tell. What did you think about the training? How did you get your first client? How long did it take? When did you see your return on investment? I mean, all those questions that you should be asking to people, you now have the ability to go back and watch these recorded webinars where I interview these people. Here's one that my son Adam interviewed. Wendy Bruno has a wonderful story. Eric, she just sent us an email, said that she was about to expand internationally. Now, I don't know what that means, but yeah. She's building this big. Here's Brandy Johnson. As you know, she went out, her and her husband came through training. And Eric, I got to tell the background of this couple. Because, folks, if you're looking into getting into business, you've probably gone to a lot of franchise sites. Well, Brandy and her husband, James, they are franchise, what do you call it, brokers, I guess? Yeah. They actually point people to various different businesses. They personally picked our business because they said out of all the things we offer, this has the most potential, and they've already got several clients within the first 30, 60 days.
Yeah. Beverly Ryder, I mean, they're knocking it out of the park, folks.
Yeah.
I mean, if you haven't heard these interviews, please go. And the great thing about it is everybody that we're showing, you can actually speak to personally. I mean, these people will take your calls, so it's not like we're just trying to set these people up and making sure that they're answering all of our questions. Talk with them personally. You interview personally.
And some of them even have physical offices. They've outgrown their home, and they've gone and decided to rent some office space and hire some employees. Renee is a good example of that. He came over here a few years back, did not have any contacts whatsoever in the entire city, but he's started doing what we taught him to do, to go out and connect with the doctors in his area. And now he has such a huge business, he doesn't know how to handle it. He's actually outsourcing his billing to other people. He doesn't do any of that now. He just kind of manages the whole thing. I mean, I could just go on and on. The stories.
This one right here, Patrick, we haven't heard from him since 2012. I think it was back further than 2008 or 9.
Oh, really? Wow.
And he's the one that just said, "Hey, I'm just letting you know I'm in business. I kind of put this up on the shelf for a little bit because my job took over, but then they were downsizing everybody, and I told my wife, look, I have this. I'm going to start using it. All of a sudden, boom, he's back into business and growing his business." So
yeah, I remember him saying, "Patrick, all I did was I went to your the LSS. That's our licensee support site. He called it the LSS." And he said, "I just went there and started looking at all the newest stuff and getting back up to speed on all this, and then just went out and found clients."
Yeah, it's what we told them to do.
Yeah,
so,
it's amazing. They did what we said to do. And there's Justin Fitzpatrick. Wow, this guy is just going at it. I mean, him and his partner have just built this thing now already, just having gone through training less than a year ago, I think, nationwide. He's got clients all over the place.
Yeah.
Jennifer Boyd, this is the thing I just told you about that we went through in
September.
Yeah, and she used this book to go out and actually give it out to some doctors, and they called her up and said, "Hey, come do business with us."
Yeah.
It doesn't get any better than that. I've done interviews with Dr. Vicki Ratner, the co-author of this book. So, folks, you actually get to hear from her as to how to go out and market to doctors. We teach you the things that you need to know about this business before you even come through the training. So if you're wondering, do we have it figured out? Yes, we've got partners like Dr. Ratner that have figured it out.
And these are all free webinars that we give you every single week. You can learn so much from that, and you should. By the time you come to training, you should be almost halfway learned everything you need to learn. And this one,
I did this interview just, I think this was just last week, Eric, wasn't it? Yeah, I think so.
Right.
And so this is a great one to hear, too. She has a terrific story to tell. You just won't believe some of the stories, folks, and that should motivate you more than anything, to know that other people from all walks of life, from all backgrounds, all ethnicities, all educational levels, they've all gone through our training, and without hardly none of them, Eric, how many of these people that I just showed even have any background whatsoever in the medical field? None.
Not any that I know of.
Val did work in a hospital, she said, but she said, I didn't have anything to do with the billing, so this business was still brand new to me, too.
Now, didn't she say that two things that I remember she said last week? She's got 36 clients, and she just turned this whole business over to her son that just graduated college.
That's right. 25 years old. She said, I wanted him to feel like he could pay me back for his college, so I just put him in charge of my office. He runs the whole thing now. She goes in about 3 days a week. Yeah.
Yeah. Yeah.
Okay. Well, folks, as you can see, in addition to doing medical billing, we also have all those ancillary services that are illustrated here by these boxes. But, folks, there's just a whole ton of stuff that you're going to learn in that week-long workshop down here in Dallas. Every one of these services, by the way, are explained in that virtual brochure. So go to our website and click on the little orange button, and you'll learn about each one of these in detail.
Yeah, Patrick, let's before we get to any more, let's hold that right there. Let's answer some of these questions here, because there's. I'm going to go back up a little bit. Jeffrey says he said that he works at a dental office and they use e-claims, and paper forms for his insurance, how do I get them to change the way that they do business? That's kind of a two-question there. First of all, do we even do dental billing? And if he did, what can he do to change?
Now let me answer that this way, folks. Yes, the bottom line is that you can do billing for dentists. But, here's the big but there, the medical field is far, far more profitable for you because it's much larger. Think about it. How many of your friends even have dental insurance? Not many. They're mostly probably self-pay, right? So the point is dentists don't see near as many patients as doctors do, and so the market's not as big. But if you've got connections like this fellow does, then yes, you might want to get started with those. How do you switch them? Now, believe me, that's a whole section of our training where we go through showing the doctors why they need to figure out a better way. It all has to do with money. Look, if we could increase their revenue by, say, 30%, would they be willing to change? That's what you ask them. And so many of them just say, yeah, well, if you can do that, I'll believe it when I see it. Now, remember, we do demos for these doctors of our system and can show them exactly how you can do that for them, why that's possible. And they can actually speak with other doctors. We have referrals already set up for you to have those doctors talk to other doctors.
Yeah, absolutely. Gaetano, I hope I said your name right. You asked a question that Patrick and I are already working on another webinar. He's asking the question, are you taking into consideration the new administration and any changes that might take place and changes/repealing of Obamacare?
Well, let me answer that this way. Eric, I'm going to show this. I know I probably shouldn't because we'll get a lot of questions about this, but I'm going to show people what Dr. Vicky and I have decided to do with this book. This book that we have been referring to, the New Medical Thriving Practice, folks, actually has a little statement on it. Let me just show it to you and let you read this here. It says right now, Eric, am I holding that up correctly here? Let me
there you go.
Got it in there. Okay, so as you can see, Eric, can you read that whole subtitle there?
Yep, how to get off the hamster wheel, work smarter, not harder, generate more revenue, and enjoy greater career satisfaction in the era of the Affordable Care Act.
Okay, so since people have looked at that and said, well, wait a minute, we may not have the Affordable Care Act anymore with the new administration coming in. Well, guess what? We've already thought about that. And yes, there's probably going to be some repealing and replacing of Obamacare. So we just put it right there on the cover now, as you can see there. We changed it. How can you do all that? In the era of repealing and replacing Obamacare. Yeah. So let me just point out this, folks. Every new administration comes up with some new thing, right? The new ICD-10 codes, the electronic medical records. Everything's changing constantly. That's the only solid thing in our world is change. So we keep up with those changes. As you can see, I'm illustrating it right here, that we already know that probably is something that is going through the doctor's minds and that we want to address. So what will happen is this. As those changes come about, our technology changes to adapt to that. And whatever it is, it's always going to be, hopefully, for the betterment of patients and for doctors. You just have to know that you're with a company who's going to stay up on that thing and stay on top of it. So that's why that's important that you realize we've even decided that the book title, the subtitle is going to be changing as well.
Absolutely. Let's get through the rest of these slides here because, Patrick, there's some people that have kind of actually listed a few questions here. We'll just take those right at the end, and we'll kind of work through the rest of these.
All right, well, go, folks, we put this illustration here because this illustrates for you, if you've not been on some of our webinars, the key advantage that you have. What is the difference between ABS and any other company that you might be looking at or any other software? Well, it's because we have all these components together. We have the iClaim, which is, of course, the practice management system that you'll use to do the billing for doctors. We have the MRX, the electronic medical records, that the doctor uses in their encounter with the patients, usually using an iPad. And then we have the patient portal that the patients can log into and update their own account, including all their changes of information, insurance. They can see all their prescriptions, all their visits, and even schedule appointments right there with the doctor online through our portal. Now, that's all pretty unique, but look at this part right over here, the clearinghouse. Eric, I don't even know how to explain this to people who are not in medical billing. They may not realize what a clearinghouse is. Why don't you kind of explain that first?
Yeah, just think of this. The clearinghouse stands between a medical billing piece of software and the insurance companies. That's where you're going to submit claims to on every billing system out there on the market except for ours. The difference is between ours and everybody else's is that with the clearinghouse right inside of our system, you can see on the right-hand side of this slide, we could communicate directly to the insurance companies. This is describing why and how we blow out the competition. Because with all these components internally working together, and they're all being worked on by the same software engineers. So whoever's working on the patient portal works on iClaim, that works on the EMRX, that works on the clearinghouse. So folks, it is the only one out there that can smoothly send information from one piece of the software to another because it's all being worked on by the same. But really, more importantly, as you can see there's nothing standing between iClaim and the insurance companies. We're able to communicate right back and forth, giving you information in real time. That's why we are superior to anybody else that's out there.
Yeah, as far as we know, folks, there's nobody that has the technology we have and has the clearinghouse built in. We don't have to send it to a third party. We don't have to depend on somebody else to approve the claim. It's all on us, and that's why our rejection rate nationwide is less than 2%. Now, that may not mean a lot to you until you realize that most doctors have rejection rates of up to 30, 35%.
Right.
So we can get them more money faster. That's what the bottom line is.
Yeah, absolutely.
All right, and then of course there's this wonderful illustration that Eric came up with as to why people should be using iClaim and EMRX.
Yeah, folks, take a look at this just for a moment. Why use iClaim and EMRX? First of all, there's mobile charting, which means that the doctors can use a tablet. They don't have to carry around a laptop. They don't have to even hire a transcriptionist. That could cost them $30,000 to $40,000 a year. Mobile charting. Increased revenue. How do they increase revenue? Because we're reducing claims that could get rejected because we own our own clearinghouse. And it's U.S.-based customer service. It has won awards for that. It's certified meaningful use. We've been around since 1998, so it's here to stay. A lot of people ask, well, what's going to happen if if I join you, Patrick or Eric, and you guys decide to go out of business in the next 9 months? It ain't happening. This is what we do. Back at the top, it's affordable, very affordable for the doctors, customizable for each doctor, for each specialty, web-based, connected. Folks, you can't. If you're trying to deal with a server-based system, you're just going to get way behind. And let me say that about the web-based system, you're not going to be able to do the macro reporting as well unless you have a web-based system. It's integrated. We can integrate with any labs, any other types of specialties that need to be integrated. And then lastly down here, specialize. Again, we can specialize for cardiologists, for OBGYN docs, pediatrics, podiatry, urology. It doesn't matter. It's won all these awards that Patrick is showing here. Folks, there's nothing out here that can touch our product. There's just not. We have the medical technology. That's all I can tell you. We just do.
Well, not only that, we mentioned earlier that we do these live demos, and this is kind of hard to illustrate, folks, but basically here's what it boils down to. If you can just get a doctor to commit to spend 45 minutes or so looking at a demo of the technology and show him proof as to why we can get his rejection claim down, then we get on there, us as ABS, our demoers, is that a word, demoers? Anyway, the people who do the demos are connecting like we are connecting with you right here today through a GoToWebinar. We connect with the doctor's office there on the left, showing them the system. You can be at your office or at the doctor's office, either one, watching the demo yourself and listening to everything that we say, learning yourself what should be said. And we'll do these demos for you from now on, but at some point, some people just get to the point where they can do the demos themselves. But we answer all the questions for the doctor as well. So you don't have to do any selling. We do all of that for you. That's why 75% of the doctors that see these demos go ahead and move forward with us.
Where can I market this business to?
Well, there's your territory. It's the whole United States, including Alaska and Hawaii. So, folks, we don't limit you because you may get a doctor here locally in your own city who loves what you're doing for them, and they know a doctor that lives in another state. We wouldn't want to be able to say, oh, I'm sorry, somebody else will have to handle that doctor. You can handle that doctor, and we'll show you how to do that, and you never have to travel even to the doctor's office. It's all done through technology using all these different things that we have in our cloud-based system. So it's pretty cool. You're not limited at all like you would be for like a franchise or something.